Okay, this is chapter 26, and we talk about microbial diseases of the urinary tract and the reproductive system. There is some overlap in the functioning of the urinary system and the reproductive tract in the male reproductive system. Now, we don't see so much of that overlap in the female reproductive system, but obviously the proximity of the organ systems there would dictate that infectious diseases that infect one system will also infect the other. So the urinary system consists of organs that regulate chemical composition of blood and excrete waste products. Reproductive systems consist of organs that produce gametes for reproductive purposes of the species, and it will support developing embryo. The urinary system consists of 2 kidneys, 2 ureters, a bladder, and a urethra. Those of you in AMP2 already know that. Those of you who have had AMP2 already know that. The urine passes down the ureters from the kidneys, where the waste has been removed from the blood, and then into the urinary bladder. Elimination eventually through the urethra. Now, important to point out that urine is sterile. Okay, urine is sterile, so you don't have to wash your hands after you go. No, I'm just kidding. All right, urine is sterile, and because of that, any bacteria that's found in a urinary tract is considered abnormal. The urethra in the male conveys seminal fluid as well as urine, and thus it has a dual role. In the female, the urethra is shorter, doesn't have to pass any products of conception, but is shorter. The proximity of the urethra to the vagina and to the rectum typically leads women to have more incidence or a higher frequency of urinary tract infections than do males. Males also produce a substance in the urethra that also is antibacterial, but the length of the urethra is also a very important factor in that the growth cycles of bacteria in the male reproductive system, in the male urethra, the bacteria has to go through several growth cycles to get into the bladder, whereas in the female urethra, because it's shorter, the bacteria doesn't have to go through as many growth cycles. Ureters, valves in the ureters prevent backflow into the kidneys and the bladder, which aids in the prevention of infection. Now, it does happen, but we don't see that many infections in the kidney. Also, the acidity of urine and the flushing mechanism of the urine also help in preventing infection. Microbes usually enter the urinary system through the urethra. Microbes usually enter the reproductive system through the vagina or the urethra in males. We also see in the female reproductive system it consists of 2 ovaries, 2 uterine tubes, not 2 uteruses, 2 uterine tubes, the uterus, the vagina, and some external genitalia. The ovum or the eggs are released from the ovaries in a process called ovulation. It passes down the uterine tube. If it's fertilized in the uterine tube, it becomes implanted in the wall of the uterus, where it will develop into an embryo or fetus. The vagina is a copulatory canal, and so it's part of the birth canal. The external genitals, the clitoris, the labia, and the glands that lubricate and secrete these areas are also important. In the male reproductive system, he has 2 testicles, male sperm and male sex hormones that are involved. They form together to form a seminal fluid referred to as sperm or semen, and this also passes through the tissue portion referred to as the penis. This is an illustration of the female reproductive system, a lateral view of the female reproductive system, and again, pay particular attention to the area where the urethra is located at, the proximity of the urethra to the vagina and to the rectum. Male reproductive system and urinary system. As you can see, common passageway here, seminiferous tubule, and then the vas deferens, which passes through the prostate gland, which communicates now with the urethra coming from the urinary bladder, and so you see a common passageway there of the 2 systems. Urine in the bladder and the organs of the upper urinary tract are normally sterile. I already said that. In infancy, the female vagina is populated by acid-forming lactobacillus, but the acidity becomes neutral in childhood, and the microbiota contain a variety of corynebacterium, cocci, and bacillus. At puberty, acid-forming lactobacillus will gain or become dominant flora. At menopause, the microbiota returns to those in childhood, or pH becomes neutral. Urinary bladder, upper urinary bladder is sterile. Again, as I said, greater than 1,000 bacteria per cc or 100 coliforms per cc of urine indicate an infection. So, bacterial diseases of the urinary system, infections of the urinary system are mostly opportunistic. In other words, they would not have caused an infection unless circumstances had eluded themselves or had presented themselves to be exactly right. So, inflammation in the urethra is called urethritis. Inflammation in the bladder is referred to as cystitis, and in the ureter is ureteritis. Microbial populations, a few of 100,000 per cc. Any single bacteria type, as few as 100 per cc of coliform, such as E. coli, are considered to be indicative of an infection. Usual causes of cystitis, E. coli, some forms of strep, staph, Proteus, Klebsiella, Enterococcus, Pseudomonas are going to be the big ones. E. coli usually causes pyelonephritis. Cystitis, inflammation in the urinary tract and the bladder. Most common infection, E. coli or staph syphilicus. Symptoms include dysuria or difficulty urination, urgency of urine, and some pus in the urine, pyuria. Pyelonephritis is an inflammation in the kidneys. Scar tissue can also be formed, which will impair kidney function. Generally, complications of the infection elsewhere in the body in females usually are the lower urinary tract infections. E. coli is responsible for about 75% of the cases. Leptospirosis, this is a spirochete, Leptospira interrogans. The disease is characterized by fever, chills, and headaches. Localization of pathogens in the kidneys may result in jaundice and the possibility of kidney failure. Leptospirosis is mainly a disease in animals which excretes organisms with their urine. Domestic dogs are commonly immunized against it. Disease is transmitted to humans and animals contact urine or contaminated water. Organisms can pass through minor abrasions or mucous membranes. And again, leptospirosis is indicative here of organisms with a flagellum and endoflagellum. So you see the corkscrew-like appearance here, transmitted through the skin and mucus by contact with urine or contaminated water. You isolate the bacterium. There are some serological tests that you can do as well. Sexually transmitted diseases. Most STDs are prevented by condoms, treated with antibiotics. One of the most common reportable communicable diseases in the United States are those caused by gram-negative Diplococcus Neisseria gonorrhea. Bacteria must attach to the epithelial wall of the urethra by means of the fimbriae in order to be infective. The organisms may invade spaces separating the mucosal cell walls found in the oral pharyngeal areas of the cervix, as in the eyes and in the rectum and in the mouth. And remember, with oral sex, you also can get gonorrhea of the throat. And again, cultured out, gram-negative Diplococcus Neisseria gonorrhea also must be treated aggressively as you would in the reproductive system. Gonorrhea in males. Males are likely to become aware of gonorrheal infection because of painful urination and discharge of pus from the urethra. Complications such as sterility resulting from partial blockage of reproductive ducts and or scarring from the inflammatory process can occur. Now, gonorrhea in females. Females may have gonorrhea and be unaware because the pain again, remember the infection in gonorrhea in females would be in the vagina, and it would not necessarily have to be in the urethra. In the male reproductive tract, it is going to involve the urethra, so there's not enough room for fluid inflammation and swelling there. In the female reproductive system, because the infection can take place inside the vagina, there's room there for swelling and edema, and so the person may not be aware of the infection. Pain can be especially noted during sexual intercourse because you can get inflammation in the adjacent organs as well. A person can have inflammation of the cervix or of the uterus itself. The infection can progress into the uterus and into the uterine tubes, turn into pelvic inflammatory process, which can also cause sterility due to inflammation and scarring. Complications of gonorrhea involve joint pain, 24 to 34-year-old people presenting to a clinic setting with an inflamed joint or arthritis is suspected to be GC arthritis until proven otherwise. Individuals can have gonorrhea and not have been treated, and then the urinary portion of the disease will disappear, but will later present with other sequelae such as arthritis. Gonococcal arthritis causes growth of gonococcal in the fluid, in the synovial joints in the synovial fluid of joints. There's another condition that we can see in infants, ophthalma neonatorum, that we may have talked about previous lecture, condition resulting from infection of the eyes in infants as they pass through the birth canal. So mother diagnosed with gonorrhea, they do a C-section. Any baby that is delivered also has silver nitrate preparation placed in the eyes to prevent Neisseria gonorrhea infections. Whether or not the mother tests positive or not, they will do that automatically. Laws usually will require the administration of antibiotics at birth to prevent this, because it can lead to blindness. Gonococcal infections can also be transferred by hands, contact in adults. Now, that's rare. I mean, you pretty much have to have dripping pus on your hands transmitted to someone, and then they have to, with their hands or whatever point that you contacted with them, it has to go through a break in the mucosa. So it's extremely rare. It can happen. This is not the disease that you find on toilet seats, though. Gonorrhea typically affects areas of sexual contact, and almost always it requires direct sexual contact. Pharyngeal gonorrhea resembles the symptoms of sore throat. I already alluded to that. You can have gonorrhea. It can be painful, also discharge pus, and you can culture this out from the tonsillar crypts. Gonorrhea, no immunity to reinfection. So even though you test positive for gonorrhea, you don't develop antibodies that will protect you from subsequent infections, unlike what we've seen in a lot of infectious organisms that you get exposed to. Currently recommended fluoroquinolones can be treated for antibodies. Fluoroquinolones are like Cipro, Tequin, Levaquin. Tetracyclines can also be used and administered, whether it's tetracycline in the form of generic tetracycline. Doxycycline can be administered as well, though doxycycline is administered for a bunch of other things as well, but usually used for STDs. Diagnosis can be made by identifying the organism in infectious discharge. Organisms observed gram-negative cocci in pairs. Serological diagnostic testing and DNA probes are also used for the purposes of diagnosis. This is the incidence of gonorrhea. As you can see, the spike that began to occur in the 1960s and 70s. And what would you suspect that was related to? What? Free love, the 70s, yeah. Free love, the advent of birth control pills. Popularity of birth control pills. And so before condoms were used, yes, to prevent sexually transmitted diseases, but it was also used to prevent pregnancy as well. Now with the advent of birth control pills, one of the factors that kind of made people do protective sex has kind of been taken away. So, Neisseria gonorrhea attaches to the oral and urogenital mucosa by fimbriae. Females may be asymptomatic. Males may be symptomatic, painful urination and pustule discharge. Treatment with antibiotics can also cause endocarditis, meningitis, arthritis, and ophthalma neonatorum. Gram-negative diplococci, classic picture for gonorrhea. Non-gonococcal urethritis. Guys love this. They come in the clinic, doc, I got a little discharge and I don't, it's just, okay, well, it didn't culture out gonorrhea, but it's non-gonococcal urethritis. Yes! But it's still a sexually transmitted disease. You still have to get the medicine and you still have to get the shots. It's not reportable. Now, the gonorrhea is reportable. Got to let the health department know, and the health department is going to contact you, or you can go over voluntarily. It's up to you. But inflammation in the urethra not caused by Neisseria gonorrhea is called non-gonococcal urethritis, and so they can blame it on other things as well, and not gonorrhea. But it's certainly the most common sexually transmitted disease in the United States. But again, it's not reportable. Most of these infections are caused by chlamydias, obligate intracellular parasites. which are not easily cultured. Tetracycline is typically the effective treatment. Other bacteria can cause it as well. Mycoplasmas, uroplasmas can also cause it as well. Pelvic inflammatory disease, collective term, refers to an extensive bacterial infection of female pelvic organs. Pelvic inflammatory disease, also referred to as PID, often caused by non-gonococcal, also are often caused by Neisseria gonorrhea. They often have a co-infection with chlamydial bacteria. That's very frequent, also important agent in the disease. Infections in the uterine tubes is referred to as salpingitis. Scarring can block the passage of the ovary and the uterus. Can also result in sterility or ectopic pregnancy. Basically, the eggs get fertilized in the uterine tube, but due to the strictures that can occur from the inflammation, recurrent inflammation causes the uterine tubes to get inflamed. They will scar down, and so the ovums can't pass all the way down through the fallopian tube into the uterus. So the sperm will fertilize in the uterine tube, but because they can't migrate any further, the person will get an ectopic pregnancy or pregnancy in the fallopian tubes, which can be a medical emergency. That's not a viable pregnancy. It will have to be removed. So pelvic inflammatory disease, Neisseria gonorrhea, chlamydia, again, can cause scarring, blocked uterine tubes. Severe abdominal pain because it can involve a number of the pelvic organs. Syphilis, also cases of syphilis remain in the United States, fairly stable over the years, causative organism, gram-negative spirochete, Treponema pallidum. Separate strain can cause tropical skin diseases called yaws. Syphilis transmitted mainly through sexual contact. Incubation period averages about 3 weeks. Several identifiable stages of the disease. The initial symptom of primary stage is a chancre or a sore, usually appears at the site of the infection. Fluid formed by the chancre is highly infectious, and the spirochetes can be seen with a dark field microscopy. In a few weeks, the lesion disappears. And in many cases, women may be completely unaware of the disease. Again, in males, because the urethra is in a narrowed area, inflammation and swelling, typically the male will present with symptoms. But because this infection in females is not in the urethra, it can be, but most of the time it's in the vagina, and so you can get swelling, you can get inflammation, and not cause a significant discomfort in the vagina, whereas if it was in the urethra, the amount of pain and inflammation, well, the amount of inflammation there would be enough for the person to recognize that they have the infection. Serological testing positive in about 80% of patients in the primary stage. Bacteria enters the bloodstream and into the lymphatic system and will become distributed throughout the body. Several weeks after the primary stage, the secondary stage characterized by rashes. Rash usually occurs in the skin, the mucous membranes, and lesions are very infectious. No sexual or non-sexual transmission by kissing, dental work, and so on is the likely transmission source. Serological testing becomes almost uniformly positive. In a few weeks, the symptoms of secondary syphilis will subside. The latent period will be entered. The majority of cases do not progress beyond the secondary stage, even without treatment, perhaps because we develop some type of immunity to it. After 2 to 4 years, the disease can be transmitted from mother to fetus, so this does not normally happen. The congenital syphilis that causes damage to infants, mental development, as well as other neurological disturbances. But now, usually, this is from contact of the baby as it passes through the birth canal. Fewer than half the cases, even with treatment of disease, will appear in tertiary stage, but it does happen. Many of the lesions in the tertiary stage are called guma because of the extensive tissue damage. The symptoms may be due to a hyperimmune reaction from our body in the surviving spirochetes because our macrophages can't completely chew up those invading microorganisms. They basically wall it off. The macrophages and other inflammatory cells will kind of surround it and wall it off. The person can have signs and symptoms of neurological dysfunction, delusions of grandeur, It's what's commonly seen. Patients with tertiary syphilis think they're Napoleon. They think they're God. They think they are somebody great. So they get these delusions of grandeur that are very common with neurosyphilis. The way to diagnose it is through the VDRL, or Venereal Disease Research Laboratory Slide Test. Is a rapid screening test for the diagnosis, such as an RPR, which can also be done. That's a card test that's done in clinical settings. It detects for antibodies, not against spirochetes itself, but the regain type of antibodies. So it's an indirect method of diagnosing syphilis. Confirmation of a positive screening test can be made by doing the fluorescent treponemal antibody absorption. Now, in most cases, you don't do that second test, but you can do it. But in most cases, if you test positive by the VDRL or the RPR, that's usually enough to initiate treatment. Treatment, of course, is the use of benzathine penicillin. 1.2 million units given in both hips, burns like fire. Total of 2.4 million units of penicillin is typically administered. You divide that into 2 doses, so it's 1.2 million units per hip. Nice little burning injection, but it will treat what ails you. If you can't take penicillin, we usually use Rocephin. 2 grams of Rocephin, again 1 gram in each hip. That doesn't feel too well either, but it will treat the syphilis. Treponemal pallidum had invasive mucosa. Again, it has an endoflagellum, so you see that typical classic picture. Again, diagnosis, dark field microscopy, but you can also do indirect serological testing, VDRL, RPR, ELISA, where you're actually testing. It's a reagent type. You're looking for like specific enzymes that are specific for syphilis to be able to diagnose it. If you get the diagnosis by VDRL or RPR, you can always do the fluorescent treponemal antibody screen, but again, that's not usually done. If you got a positive RPR, you're going to usually get treated, especially if you got a positive RPR and you got symptoms. That's a nice fluorescent picture. Primary, secondary, latent period, no symptoms. In the tertiary period, that's when you get the GUMAs. And so you should know those 3 presentations for testing purposes: primary stage, secondary stage, tertiary, GUMAs. Congenital neurological damage, primary, secondary stage is treated with penicillin. Chlamydia trachomatis is another infectious organism that can be in the reproductive and the urinary system. Causes lymphogranuloma venereum, disease found in much of the tropical world in the southeastern United States. Causes regional lymph nodes to become enlarged and tender. Scarring of the lymph node, drainage of the ducts occasionally leads to massive enlargements in the male genitalia and the rectal areas as well. It can cause a narrowing in any opening that's in the reproductive system, which can lead to significant scarring. So chlamydia trachomatis, lymphogranuloma venereum. A chancroid, this is a soft chancre. This is mainly a tropical disease. We see this in the United States, reported often associated with drug users. A chancroid is basically a painful ulcer that forms in the genitalia and spreads to adjacent lymph nodes. As it gets to the next lymph node, it breaks out and another ulcer will occur. Causative organisms, Haemophilus ducreae, Chlamydia trachomatis, and the initial lesions in the genitalia area can be treated with antibiotic therapy. Again, one of the tetracyclines or doxycycline can be administered and is quite effective. The treatment for the chancre is typically erythromycin, or you can give Rocephin ceftriaxone, which is a second generation cephalosporin. Bacterial vaginosis. This is vaginitis, an infection in the vagina caused by a number of different organisms. You can get inflammation or vaginitis from a Candida infection, Candida albicans, which is a yeast infection, protozoas such as Trichomonas vaginalis, and bacterial Gonorrhea vaginalis can also be an agent that can cause vaginitis. Candida albicans usually is an opportunistic infection. Normal microbiota usually is killed off with antibiotic therapy. So I put you on a course of antibiotics for an upper respiratory infection. That antibiotic kills the good bacteria in the vaginal flora. Then you don't have the good bacteria that's there to compete with the fungal elements for food sources and nutrients. And so now the Candida will begin to grow out of control. This is how most vaginal candidal infections can be started. Trichomonas vaginalis and other forms of sexually transmitted diseases as well. Gonococcal vaginitis infections, also called nonspecific vaginitis, can involve interactions of anaerobic vaginal bacteria. There's no signs of inflammation. The term bacterial vaginosis is preferred to vaginitis. The diagnosis is typically made with clinical presentations. There can be a fishy or a foul odor. There can be change in vaginal pHs above 4.5. You can also see what's referred to as clue cells. Clue cells are basically sloughed off epithelial tissue from the vaginal wall that can be taken out on specimen or exam. Also, you can diagnose gram-negative rods in the discharge. These individuals typically need to be treated with metronidazole, also known as Flagyl, which will eliminate anaerobic bacteria that's used in the treatment. The use of Flagyl can be given orally or it can be administered intravenously. You can give it as a one-time dose. It comes 500 milligram tablets. You can take 4 500 milligram tablets at one time as a one-time dose. And a lot of times if we worry about compliance in the clinic, we get the patients, nope, you're going to take it right here, you're going to take it right now in front of me. And I'm also going to give you 1.2 million units of penicillin in each hip. And that's called the shotgun approach, where now you're treating all of the potential infectious organisms, especially if the person doesn't want to go through any kind of exam or any type of testing. Because just because they have nonspecific vaginitis doesn't mean they don't have chlamydia, doesn't mean they don't have syphilis, doesn't mean that they don't have gonorrhea. And so individuals should be treated fairly aggressively, especially if there is a fear of compliance with the regimens. Another form of vaginosis is Gonorrhea vaginitis, diagnosis with, again, with clue cells, and then treatment with metronidazole. Herpes simplex virus was what I thought that next slide was, but it wasn't. Herpes simplex, several forms of herpes simplex type 1, 2, there's even 3, 4, 5, and herpes simplex type 2 and sometimes type 1 is a sexually transmitted disease. Typically referred to as genital herpes. The official name is human herpes virus type 1 and 2. Lesions can cause a burning sensation, small vesicular cropping of little bumps, typically clustered together. The severity of these infections depend on the individual. Does not necessarily have to depend on the exposure or where they contracted it from, but depends on the immune system and the degree of exposure. Lesions are infectious, causes a serious danger of infection to infants at birth. Neonatal herpes can be fatal and can cause serious neurological damage. Virus enters in the latent stage in the nerve cells, and it will reappear at intervals, similar to what you see with a cold sore. A cold sore actually is a form of herpes simplex virus type 1. Typically you get exposed, you can have it on your lip, or can have it in your nasal pharynx, you can have it on your face. But herpes simplex type 1 just typically refers to lesions that are above the waist. Herpes simplex 2 typically involves the reproductive organs or the urinary tract. Again, the cropping of the lesions, the reappearance of the lesions. You can have a lesion today, runs its course over about 7 days, and goes away, may be gone for a month, may be gone for a year, but some trigger will stimulate that virus that lies dormantly on the nerve to re-exacerbate itself, and you'll get the blistery lesions again. So a similar presentation like you would see for a cold sore, except for it's in the reproductive organs. So typically you get a cutaneous presentation. On men it can form anywhere along the shaft of the penis or the head of the penis. In females it can form along the mons pubis, the labia majora, or it can be inside the vaginal wall themselves. Treatment, of course, is typically given antiviral, either acyclovir, valacyclovir, famvir. Valtrex is the most popular agent that's out there now. But these agents are typically used. There's a topical preparation of acyclovir. The others all come either orally or intravenously. Most people will take the pills now. For fever blisters, they found that acyclovir actually works pretty good on fever blisters as well, so it will certainly decrease or shorten the course of a cold sore as well. Again, that's herpes simplex type 2 when we talk about genital herpes. And again, the serious problems can be associated with neonatal exposure. So if neonatal gets exposed to herpes, transmitted to the fetus and or the newborn, it can actually lead to death. And treatment, acyclovir and valacyclovir. And then genital warts, and I think that's your lab assignment for this next time. I'm almost done. The papillovirus serotype 16, that's the one that can lead to cervical cancer. That's your test question. Serotype 16 papillomavirus. Papillomavirus also is felt to be the cause of cervical cancers, also cancers of the penis as well. Vaccinations are now available for human papillomavirus, but again, HPV 16 is the typical cause. Candidiasis, we've already talked to on multiple occasions. Candidiasis albicans, a yeast infection that can affect the vaginal mucosa or the vulvovaginal areas. Rarely do you see it in males because the male reproductive organ, the penis, is air exposed. The vaginal mucosa has a moist median. The vagina secretes fluids and secretions that Candida will grow in that median. The male member is typically exposed to the air, and because of that, typically Candida will not grow in that environment. Predisposing positions to or predisposing conditions to candidiasis are pregnancy, diabetes, certain types of tumors, certain types of immunosuppressant therapy, broad-spectrum antibiotics, which kill the good bacteria and allow this to grow. Diagnosis and treatment, once diagnosis is made by microscopic identification, you don't have to do microscopic identification. Grossly, you can see if a person has vaginal candidiasis because typically the fungal growth is so thick and it's a whitish, cheesy-like discharge that is notable. It can sometimes be associated with discomfort. You can, the woman can complain of itching and burning, but sometimes it doesn't have to have symptoms. Chlorotrimazole, miconazole, fluconazole are typically given. And now the oral preparation, oral dosages of fluconazole are readily available and can be given in a one-day dose. You just take one pill one time and it will treat the infection. Some women like to take it for 3 days, so it just depends, but it will clear the Candida infection. Trichomonas, we already talked about. Basically, it's another fairly normal inhabitant of the female vagina and in the male urethra. So it can be cultured out, and the person asymptomatic does not have to undergo treatment because it's a part of the vaginal flora. Trichomoniasis, however, results when the acidity of the vagina becomes disturbed, and then the protozoa will begin to grow out of control. Males rarely have symptoms. Females usually exhibit a purulent discharge. Again, you can treat this with Flagyl as well.